This is the future.
Today is May 28, 2023. It is 12:32 a.m. So one of the charities that I will be covering in this video is Project Angel Food. So this is another charity that Harry and Meghan had volunteered in, I think around the pandemic. And Archewell, I believe Archewell was not public yet. This is one of those charities that was not in their impact report. So I'm highlighting it in this video. So one of the questions that popped up into my mind as I was looking to highlight this charity is, how did she know about it? How? Because there's so many charities they got involved in, and sometimes you want to know, how did they know? Or where was their starting point? How did they come about? Or something like that. So I looked for it and I got my answer. It's right here. Alright, so the question that I wrote here, how did Harry and Meghan get involved with Project Angel? Okay, according to Richard Ayub, sorry if I pronounce it wrong, Project Angel Food Executive Director, it was Meghan's mother, Doria Ragland, who suggested that the organization needed volunteers and that they could participate. Okay, so that was back in 2020. So that's from Entertainment Tonight. Let's click on it and see if we could find more. Okay, so there they are. They went and volunteer. Okay, I remember when this was in the news as well. Okay, it previously reported that Meghan and Harry have been working with Project Angel during the coronavirus outbreak. Friday outing came after first delivering meal on Easter Sunday and then again last Wednesday. According to Richard Ayub, there's the part that I read, Project Angel Food Executive Director, it was Meghan's mother, Doria Ragland, who suggested that the organization needed volunteers and that they could participate. Okay. I went on one delivery with Harry and Meghan. They were all about the client, all about service. Ayub told ET via video chat on Thursday. Yesterday, we got a call from one of the clients saying, was that who I thought it was? Because they're wearing their masks, they're wearing gloves, they are very casual dressed. Okay, Ayub went on to say that Meghan and Harry weren't interested in promoting their charitable efforts, explaining they wanted to do it quietly, and they did. Okay, I am blown away that they chose us. They care about our vulnerable population. Ayub previously told ET, our client are most at risk to contract the coronavirus, having compromised immune system, including heart disease, lung disease, diabetes, and most over the age of 60. The generous volunteer work comes at an important time for Project Angel Food, which prepares and delivers meals to people living with critical illnesses. With the COVID-19 pandemic, 400 new people have signed up to receive meals from the organization. The charity currently serves 1,600 meals a day. Whoa, that's a lot, which will now rise to 2,000. The organization appreciates donation of any amount which can be made here. All right, so there's the link. You could click there. For more on the couple philanthropic endeavor, see the video here. All right, so the link of this will be in the description. So I have this also, that's from Bazaar. That's another article that explained about the charity, you know, what Harry and Meghan did. If you care or if you want to know more, the link of this will be in the description. Since I read the other article from Entertainment, it sort of explained how they got involved. All right, so now I'm gonna go into Project Angel website to see how, you know, they run their business, how they run the charity and things like that. Okay, so I'm not gonna go through all of them because it's a lot. Okay, so let's start in 1994, and then maybe I'll pick a random number in between and then the last one. So let's start with 1994. Okay, community coming together for life, for love, for as long as it takes. 1994, over 100 people called for meal service each month. Barry Diller, David, okay, so these are names. David Geffen, Barbara Streisand, and Ron Burkle give lead gifts for a new kitchen. Groundbreaking is held in July, and the new kitchen is fully operational by November. Deliveries are expanded through drop-off centers to include Pasadena, downtown, and Greater Hollywood. Ron Burkle agrees to underwrite kitchen rent on behalf of the Ralph Food for Less Foundation. Divine Design is held at the Pacific Design Center. Okay, so I guess 1994, that's where they start their kitchen. Okay, let's pick something in between. So from 1994, let's pick 2001. Okay, community coming together for life, for love, for as long as it takes. 2001, over 2.5 million meals have been served. Whoopi Goldberg is honored at Angel Award. Elizabeth Taylor returned to Project Angel Food to present the honor. 665 new clients enrolled in our meal delivery program. 48 volunteer orientation trained over 724 new Project Angel Food volunteers. Okay, let's go to 2021. If you want to read each one of these, the link will be in the description. Okay, 2021. Okay, Project Angel welcome volunteer back into the kitchen after 13-month suspension due to COVID-19. The kitchen served more clients than ever before in our 32 years history, and the Native American Diabetes Project, a 2-year study conducted with USC Kirk School of Medicine, began trial to measure health outcomes through use of Project Angel Food medical tailored meals. The 14 millionth meal in Project Angel Food history was presented to longtime client and AIDS activist Richard E. on June 3rd with founder Marianne Williamson, Polly Perret, Sandra Lee, Rifus Wainwright, and CEO Richard Ayub in attendance. Okay, so there's much more. Let's go back. Okay, about us. Let's look what they all about. Okay, so they also have a YouTube video. Go check it out. The title is Richard Ayub website welcome. Okay, so go check that out from Project Angel. Project Angel Food prepares and delivers over 1 million medically tailored, I should have read that first, medical tailored meal each year, free of charge, to homes of men, women, and children affected by life-threatening illnesses. Okay, so no wonder why the hospital had used their kitchen, okay, to do the experiment. Okay, so these are people who have the immune system that, you know, they have to be careful with what they eat. So this is what they do here. Okay, declare essential service during the COVID-19 pandemic by Los Angeles Mayor Eric Garcetti. Project Angel Food has expanded to meet the moment and the need throughout Los Angeles County to deliver medically tailored meals and nutritional counseling services to more than 2,400 people per day. This is an increase of 54% from our pre-pandemic numbers. Under the care of Project Angel Food's registered dietitian and in consultation with each client's primary healthcare case manager, clients receive one-on-one nutritional counseling and a customized menu that is designed to meet the unique needs of their diagnosis and align with their personal dietary restrictions and preferences. Currently, the Project Angel Food Kitchen creates 13 variations of each menu. Wow, that's a lot. You know, that reminds me of Well Central Kitchen. Unlike Well Central Kitchen, this one focuses on people who have some sort of immune system where, you know, some of them, for instance, might be allergic to nuts. Okay, so they make sure the food that goes to these people who's allergic to some sort of a nut doesn't have any, don't use cooking meal that have anything to do with nuts or something like that. All right, so unlike Well Central Kitchen, they don't really look into this specific. All right, so they just serve people food, and if you know you're allergic to something, you just have to tell them, does this have that, does this have that, or you don't eat it. All right, so that's this. Let's go back. About us, board and staff. Okay, Okay, so for the sake of it, these are the names that help the project the organization runs. Okay, program and pilots. Okay, so there's here programs and pilots. Medically tailored meal. Food is medicine isn't just a motto, it is a foundation to Project Angel's food medically tailored meal delivery program. Alright, so if I want to go more into that, I could click that. Alright, the Wilbur May Foundation Health Morning Program. The Wilbur May Foundation Healthy Morning Program provides funding for nutritious breakfast 7 days a week delivered directly to home of children in need. Breakfasts include homemade granola, oatmeal, cereal, cheese stick, raisins, and milk. Okay, very interesting. Congestive heart failure pilot program. Okay, so let's go to this. It seems like it needs, I don't want to just go run through it because it needs to be understood. Okay, let's see here. Medically tailored meals. Project Angel Food prepares and delivers over 1 million medically tailored meals each year. The medical lives of Project Angel Food clients are complex, that definitely. Okay, and they require an equally complex nutrition intervention. Our meal plans are designed to fit the unique needs of the individual. This is what I was saying at the beginning, where unlike Well Central Kitchen just cook whatever it fits, to make the meal to deliver. But this one have to be very specific to make sure each ingredient, for each client, don't have certain things so they don't affect their immune system. Okay. The same way food is health, food could also be something that could hurt you as well. Okay, we have developed a sophisticated set of food and nutrition standards founded in research that have been shown to result in better health outcomes, lower healthcare costs, and improve patient satisfaction. Project Angel Food Associate Director of Nutrition and Services and Therapeutic Elisa Baldino, MPH RD, and Executive Chef John Gordon collaborate to design diet based on scientific research that improve clients' health outcome with a variety of medical conditions. A client living with diabetes requires different dietary guidelines than someone living with cancer or congestive heart failure, etc. Yeah, so that I understood. So it needs to be highlighted because this is the core of their project, of their existence. Okay, broadly, Project Angel Food prepares meals that fall into 6 categories. Okay, 1, all meal prepared at Project Angel Food are designed to be in the category of heart healthy and diabetic friendly. Okay. 2, chronic kidney disease meals are designed for clients with kidney issues who have later stage of disease and whose bodies have difficulty processing waste. These meals are low in sodium, phosphorus, potassium, and protein. Protein that are used need to be high quality and low in fat. People who work out as well, who's into fitness and let's say bodybuilding, this is something they should look into as well. Okay, GI friendly meal of food for cancer client because the meal prepared without a lot of sauces or flavoring. They are little bland. Chemotherapy tends to make people not want to eat, and spicy food are especially challenging. Okay, vegetarian meal are all heart healthy and diabetic friendly. Renal meal are designed for clients with severe kidney issues and on dialysis. This diet is like the CKD diet, but gives more protein due to the loss and cure while being on dialysis. It also controls carbohydrate and limited saturated fat. Okay. 6, soft and bite-sized meals are designed for clients who are not able to bite off pieces of food safely, but are able to chew bite-sized pieces down into little pieces that are safe to swallow. Soft and bite-sized meals need moderate amount of chewing and pieces of bite size to reduce choking risk. soft and bite-sized meal are eaten using a fork, spoon, or chopstick. Alyssa is constantly updating our evidence based guideline and standard based on the most up-to-date research. She collaborates with nutritionists and medical experts around the country to continually inform and improve our own medically tailored meal program at home. Alyssa says the keys to success of this program are: 1, creating consistency with portion size to help monitor the exact nutrition each client receives. This is, I'm thinking, this is huge, and it takes a lot of time and care, and to be very, very careful as they cook their meal. So I wonder, how do they do this in terms of timing, because they're serving people every day and it's a lot of client, and depend on, okay, will there, wow, so many questions. Is the kitchen divided into several portions where at the same time all of those, or they have different chefs doing certain meal for different people at the same time? Because for instance, when you think of breakfast, lunch, dinner, typically lunch and dinner part where they're preparing the meal, wow, it's a lot of work. Let's just say it's a lot of work. Okay, being rigorous about updating recipes with the latest research, providing one-on-one client counseling so they are armed with information when they transition off service or are having a meal on their own. They know what food to avoid and how much of those food they should eat. Okay, so in other words, when, let's say for instance, this particular client is about to leave that program, they're gonna be on their own, so they train them to know, okay, this is how you're supposed to eat and how much you should eat and all of that, and what should the food contain that will be good for you and what you should avoid. Okay, so I see that. Okay, Project Angel Food is a member of the Food is Medicine Coalition. Okay, Project Angel Food is a member of the Food is Medicine Coalition, an association of nonprofit medically tailored meal providers who serve people and communities across the country who are too sick to shop or cook for themselves. This is huge. This is huge. Wow. Okay. Program pilot, corporate and foundation partners. Okay. There's this Project Angel Food. There's this corporate foundation partners. Project Angel Food receive financial support from cooperation and foundation, both local and national. All grant funds go directly to our core program, cooking and delivering meal and providing nutritional counseling to the seriously ill throughout Los Angeles County. Okay, so they only they are based in LA. So I'm wondering, do they have different places, let's say different states that have similar program? All right. Project Angel Food is grateful for the support from generous local and national corporate and private foundation that support our life-saving mission. Okay, so there's their numbers. Okay, for many ways in which you or your foundation can support Project Angel. All right, so this is their phone number and their website. Okay, below is a complete list of the private and corporate foundation support received a fiscal year 2022. All right, so you could go on their website and check all of this. So they have, okay, City National Bank, okay, California Foundation for Stronger Community, Avon Foundation, okay, Bloomberg, there they are, Bovid Inc. Oh, they have a good, okay, Oxford Health. Okay, so Yum Brand Foundation. Okay. All right, so check them out. All right, to see all of their partners. Let's go to the next one. History, and I think I went on to that. I read 94, 2001, and 2021. So let's see, financial and annual report. Let's see, what do we have? Oh, it's a lot. It's a lot. From 2009, It's a lot. So I'm just gonna read this, but you could go on their website and read all of this. Okay, financial and annual reports. Project Angel Food prepares and deliver health meals to feed people impacted by serious illness, bringing comfort and hope every day. We cook and deliver over 1 million nutritious meals each year, free of charge, to the homes of men, women, and children affected by life-threatening illnesses. Our vital food and nutrition services, including medically tailored meal and nutritional counseling, help undeserved people throughout Los Angeles County who are too sick to shop or cook for themselves. Project Angel has received Charity Navigator's highest 4-star rating 2 years in a row. Charity Navigator rate over 160,000 charities each year, with a goal of informing donors how efficiently a charity will use their support, how well it has sustained its program and services over time, and its level of commitment and accountability and transparency. Project Angel Food has earned the best rating possible. All right, so this is their report from various years. So go check it out, because I'm sure there's like 34 pages from each, if not more. Alright, so they have to explain how they spend the money they receive, what money comes in, and all of that. Okay, so annual report. Let's see here. You could look at the annual report. Alright, IRS 990 forms. Alright, so there they are. Just go there and check them out. Okay, different years. Okay, what else? Privacy policy certification. Let's see here. Kitchen certification. Okay. Project Angel Food Kitchen not only cooks and prepares fresh and healthy meals for our client, but we also hold ourselves to the highest of culinary safety standard. Foodborne illnesses are a constant concern to public safety and a burden on our cost of living. As our meals are served to our most vulnerable neighbors, Project Angel Food take food safety and certification very seriously. I will assume they are, because you're dealing with people who's already, their immune system is very fragile. Any misstep is devastating. Okay, our kitchen looks at food processing, storage, preparation, packaging of meals, and production of our food as part of our commitment to food safety standard and the state of California and the overall health of our client, volunteers, and employees. Project Angel Food chefs are in compliance with the California food handling laws. This is good. California SB 602. Okay, SB 602 require workers to receive food safety training. Okay, the food handlers card ensures that restaurant employees receive a reasonable level of training and food safety practices to reduce the potential for foodborne illnesses. Okay, the CFH card is to be held by anyone who is involved in the preparation, storage of food service of food in a food facility. So anyone who's working with them, I guess, who's into handling the food, they need to have that. Okay, certified food protection manager. A certified food protection manager is a certificate that is obtained by anyone in a facility that prepares, handles, or serves non-packaged, potentially hazardous food. This certificate affirms that the bearer has been educated and knows the comprehensive principles behind cleaning and sanitation, food safety, time and temperature control, and pests. The CFP card meets the California Health and Safety Code section 11948 B2. So in other words, everyone who's gonna either volunteer or do all sort of things, they need to have some training and follow protocol because of the type of people they are serving, because of their immune system. Okay, and no wonder why. Okay, now I see some of the articles that I read, they specifically mention they're wearing masks, they're wearing gloves, and all of that. So they want to make sure to highlight these things because it's part of the safety aspect. Okay, when I mean they're wearing gloves, I'm talking about Harry and Meghan. Alright. Environmental health and Project Angel Food. The California Retail Food Code emphasizes inspection of food facilities. The focus of these inspections are to ensure that the 5 most prevalent risk factors for foodborne illness to occur are not present in the facility, and that the 5 interventions are present. Project Angel Food has always received an A-letter grade after all of our inspection. This means that the Project Angel Food facility has never scored below 90 to 100 on the Food Official Inspection Report. Project Angel Food Kitchen has received numerous certifications of excellence, meaning that the facility has received 3 or more consecutive A rating. That's very, very important. Okay. Privacy policy. Project Angel Food recognizes the value of your privacy and believes that information about our website users should be used responsibly and appropriate to respect and protect the privacy of our website users. We operate site in accordance with the following privacy policy. By using the Project Angel Food site, you consent to the term. Okay, so these are things you could read and all of that. So this has to do with laws and other things. I want to focus on the system itself. Job and internships. Let's see here. Oh, okay. Let's see here. Project Angel Food, jobs and career. Well, I guess you could search cook. Okay, so they're looking for people who could cook. $23 an hour. Okay, Project Angel Food, you could apply. Okay, so this is a job that they have here. If you, okay, wow, this is very interesting. This is the benefits they provide: 401k, dental insurance, health insurance, pay sick time, pay time off, vision insurance, shift, day shift, morning shift. Wow, this is the thing that I was saying before when they're cooking. Because there's so many different aspects. What was it? 6 lists of type of food they sort of create to tailor to their clients because of their immune system. Okay, so they have those shifts. Okay, weekday range, Monday to Friday, rotating weekends. Okay, so I see one weekend you work and another weekend you take off. Okay, weekend availability. So this is application. They're looking for cooks. All right, so this is how much they asking: $23 per hour. So that's pretty decent. All right, so what did I do here? All right, so let's go back. Job, question and location, our service, nutrition service, become a client. Let's see here. Nutrition service. Proper nutrition is a key factor in maintaining and improving clients' health. Our chef and the team of registered dietitians work together to create tasty and healthy meals specific to your diet needs. Our meals are set in a 12-week cycle menu and are designed with variety in mind. Additionally, every client receives a bag of fresh fruit or fruit cups with every delivery. Okay. Upon enrollment, one of our registered dietitians will review your health. Wow, this is very impressive. All right, so they need to do an interview with you. Let's say, for instance, you have some issues. You can't really go out to buy your food so you could cook it. So you call them, you want to use their service. So before they could start cooking for you, they're gonna have someone to interview you to know your health wise, how it is, and what some key aspect they should consider. That way when they're making their meals for you, they know what to include and what to not include. Okay, so they do a small interview. All right, that's my understanding. Okay, our chef and the team registered dietitian work together to create tasty and healthy meal specific to your diet need. Our meal are set in a 12. Okay, I read this already. Enrollment, one of our registered dietitians will review your health and nutrition information that was provided by your medical provider in order to assign you to one of our menus. Additionally, we offer one-on-one nutrition counseling to any of our clients who are interested. Okay, our menus: variety, flavor, freshness, color, portion, size, and nutrition. Rich protein, vegetables are key to creating Project Angel Food Nutrition and delicious medically tailored meal on menu plans are designed on a 90-day rotation cycle so that our client have fewer repeat meals. For a list of our menu, you could go there. So in other words, so they make rotation. So let's say in a week you have specific type of food. It could be the same maybe, and then the following week they changed it, all right, but still fit to your need, this kind of thing, so you don't get tired of it. All right, our menu follows specific nutritional guidelines to provide the required nutrition to optimize our client's health. We recommended 12 different dietary modifications to help meet the individualized need of our client. These include heart healthy, low fat, diabetic, renal, low protein, chronic kidney disease, gastrointestinal friendly, low fiber, mild spice. No pork, no fish, no nuts. That's the thing that I was saying. So when some people might be allergic to these things. Okay, no lactose, vegetarian, mechanical soft. Okay, that's people who have issues of biting and stuff like that. Please note that we cannot accommodate most food allergies, gluten-free, kosher, halal, or vegan diets. Our kitchen is not an allergen-free environment. This is important to be aware of if you have a serious or life-threatening food allergy. If you have any questions regarding our menu, please contact the nutrition department, and there's the number and there's the website. Okay, so that's very interesting. Let's go back. Okay, Nutrition Services, becoming a client. So let's say, for instance, you have issues, you want to contact them. So let's see what is required of them. Becoming a client. If you, a loved one, or someone you know has been diagnosed with a life-threatening illness and are unable to independently access healthy food, our home delivery meal program may be help you need. Enrollment form can be found below. If you have any question or require assistance filling out the form, please do not hesitate to call. So they help you to fill it out as well. I guess you could call and then you give them, they will ask you a question and they fill it out for you, or I don't know, just call them. Step 1, enrollment forms. Fill out, sign, and send to us all of these 5 forms. They can be downloaded from this page or call, there's the phone number, and we will mail or email the form to you. If you reach our voicemail, please leave a message with your name and telephone number. Okay, so enrollment forms downloaded here. It's both in English and Spanish. Alright, so these are the forms. You could do it in English or Spanish. Medical certification form, download here. I guess your doctor, they need to know that you truly have issues. I don't know. Okay, note you must fill out and sign the top of page 1 of the eligibility and consent form. The rest of page 1 is to be completed by your doctor. So that's what I'm assuming. Yeah, your doctor needs to fill it out so they know that you do have a medical issues. Okay, all form must be completely filled out in order to be considered for service. We comply with California state confidentiality laws regarding all protected health and personal information. As such, if a service provider or emergency contact would like to refer a client for service, he or she should fax confidential release form. Wow, this is very interesting. Let's say your doctor knows you're gonna need it and they contact this for you, so they need the client to have consent the doctor to do that. That's some, for example, how I got it. Okay, once eligibility form are received and reviewed by our eligibility committee and a new client is approved for service, a call will be made to conduct an intake interview. We are able to conduct intakes in English and in Spanish. A nutrition assessment conducted by a registered dietitian is part of the intake process. Special diets are available according to each person's medical requirements. Yeah, so there's a process. You fill the thing out and your doctor have to fill it out, and then it goes to a review and they will see if they approve you. First of all of the form needs to be filled out. Okay, and then they will consider if you are eligible. Then once, let's say, you are eligible, they will have someone call you. Okay, so they will do an interview with you. a dietitian to speak with you to understand, what you're allergic with, what you're concerned, what food you like, what food you don't like. I'm just putting this out there. This is how I get it. Okay, step 2, when you become a client, we will ask you detail about contact information, your medical history, and food allergies, like I was saying, list of medication you're taking, and specific detail about how to access your apartment or house. This interview can take place in Spanish or English. If someone does not qualify for our service, information on additional food resources will be provided over the phone. Okay, so if you're not qualified or they don't accept you, I guess they will give you another alternative. Maybe they will not be able to help you, but someone else will. That's what I'm getting. Maybe another organization. Step 3, meal confirmation. Once all of your forms have been processed, approved for service, and your interview has taken place, our client services staff will contact you to confirm your delivery date and time. Okay, frequent asked question, when is the client delivery day? Okay, so there's all of this. You could check it out. Okay, so this is after you've been approved. They're gonna deliver the food for you. They already know as much information about you and all of that, so you have all this kind. All right, so you need to let them know how they could access your apartment. Let's say, for instance, you can't get up or out of bed, or I don't know, you need all this. They need to know in advance, so that way when the person come to deliver your food, they know how to access your apartment. And this is why they want the consent form and all of that. Okay, so let's go back. So I did this: press room, press release, general information, general photos, media coverage. All right, stories, photos of the week, recipes. Let's look at recipes. I skipped some stuff. All right, recipes, February 17. Wow, these are the portion size. Okay, I'm just gonna read what's there on each one of them. American Hot Month recipe: cod and ginger tomato sauce. As American Hot Month continues, Project Angel Food is serving you up another hot healthy meal. This time, Project Angel Food executive chef John Gordon cooked cod and ginger tomato sauce. All right, so there they are. You could check them out. Okay, so let's look here. They look good. Okay, where was that? Recipe, volunteer, individual and groups, customized volunteer experience where you could donate. Okay, upcoming events, becoming a client. So this is where you will go to fill out the form, I guess. Volunteer. All right, so I think this is pretty good. All right, I covered the most important parts. All right, let's do becoming a client. So this is where, okay, so I read that already. Events, donate. Let's see here. This is where you could go and donate. Okay, did you know 86 cents of every dollar donated goes directly to our medically tailored meal delivery program? Help support Project Angel Food work today. Your donation will ensure that someone who is seriously ill will not go hungry. Sponsor a van. Project Angel Food believes that food is medicine and food is love. Our fleet of van crisscross the 4,700 square mile via 52 delivery routes in Los Angeles County daily, bringing medically tailored meal to our neighbors near and far suffer from critical and terminal illness. One of the things that I'm thinking in terms of gas, the people who deliver, they have to drive to those places, so money into gas as well. Circle of Angels. Circle of Angels is a compassionate group of dedicated donors who generously provide both the financial capacity and advocacy that sustain Project Angel. All right, we could go in there and click and find out more. Ways to give. Project Angel Food is a community funded organization. Your donation and any amount makes it possible for us to prepare and deliver healthy meals to feed people impacted by serious illness. Okay, so the link of Project Angel will be in the description. You could check all of these out. Okay, so that's it. So I've already edited the video, and I just realized one of the most important part that I should have done at the beginning of the video is to find out how Project Angel Food started. So I'm gonna put it at the end because I have some timestamp that I put on the video. So if I put this at the beginning, it's gonna mess up the timestamp. I don't want to go all over it completely. So let me see how Project Angel Food started. Okay, so in 1989 through 1990, the Project Angel Food program was founded by Marianne Williamson as an outreach program of Los Angeles Center for Living, which help people with life-threatening illnesses. The Center for Living provides numerous programs such as the Clean Team, Project Nightlight, and Hospice Care. Okay, so that's from Wikipedia. So there's another thing here, and I try to click on that link. It's not there. So for life, for love, for as long as it takes, Project Angel Food was created by a group of compassionate volunteers who were concerned about our most fragile community members suffering in silence from malnutrition and the many other ravage of HIV/AIDS. We expanded our service to any person battling critical illness. So from reading, going to their website, I've seen that they accept all sort of type of people, but you have to go through a process. So let's see if this goes. Let me see. Yeah, the page is done. So this was the thing I should have done, which I did not do. And I wanted to know how it started and who came up with the idea, which is Marianne Williamson. So they started because of the AIDS pandemic. So I just read it. All right, so I'm gonna include that at the end of the video. That's it. Please take a moment to subscribe, like, and share. If you want to support this channel, there's a PayPal link and a Cash App link in the description. You could donate. Those who have donated, thank you. Alright, so that is it.
Evolution. This is the future.